Are you struggling with your newborn sleep schedule, or maybe you're unsure about the right way to burp your baby? Welcome to our deep dive into the world of new parenthood, a journey that's incredibly rewarding, yet undeniably challenging. In this video, we'll tackle some of the most common issues new parents face and offer practical solutions that can make this journey smoother. Rest assured, with a little guidance and a lot of love, you've got this. By the end of this video, you'll have a better understanding of how to handle some of the most common challenges faced by new parents. The first challenge we'll tackle is your newborn sleep schedule. Sleep, as we all know, is essential for everyone, especially for newborns. It aids their growth, brain development, and overall health. But getting a newborn to follow a sleep schedule can be as tricky as solving a Rubik's Cube blindfolded. Firstly, establishing a calming bedtime routine can make a world of difference. You might start with a warm bath, then maybe a gentle massage, followed by a bedtime story or lullaby. This routine doesn't have to be elaborate or long, just consistent. Eventually, your baby will start to associate these activities with sleep. Think Pavlov's dogs, but with less drooling. Secondly, understanding your baby's sleep cues is crucial. You see, babies have a way of telling us they're tired, and it's not always by yawning. Some babies might rub their eyes, others might pull their ears, and some might just get grumpy. Once you've identified these cues, you can put your baby down for a nap before they become overtired, which can make it harder for them to fall asleep. Now let's talk about managing expectations around sleep. You've probably heard the phrase sleeping like a baby and envisioned hours of uninterrupted sleep. But the reality is, newborns sleep in short bursts, anywhere from 20 minutes to 4 hours at a time. Their tiny tummies need frequent refills, which often means frequent awakenings. So if your baby isn't sleeping through the night, don't worry, it's perfectly normal. Also, remember that newborns have their days and nights mixed up initially, and it takes a while for their circadian rhythms to kick in. So be prepared for some late-night parties in the nursery in the early weeks. Lastly, don't forget that consistency is key. Try to keep the bedtime routine and nap times as consistent as possible. However, it's also important to be flexible. Some days will be better than others, and that's okay. Remember, every baby is different, and what works for one might not work for another. Be patient and flexible. Now, let's move on to feeding and burping your newborn. Feeding your little one may seem daunting at first, but with time and practice, you'll soon become a pro. When it comes to feeding, the first thing to remember is to feed on demand. Newborns typically need to be fed every 2 to 3 hours. However, it's crucial to pay attention to your baby's hunger cues. These can include things like fussing, crying, or making sucking noises. Breastfeeding or bottle feeding, it doesn't matter as long as your baby is getting the nutrition they need. If you're nursing, ensure a good latch. This means your baby's mouth should cover a large part of the areola, not just the nipple. If bottle feeding, hold your baby at a slight angle, with the bottle tilted so the air rises to the bottom, ensuring your baby is drinking milk, not air. Now, moving on to burping. Burping helps to get rid of some of the air that babies tend to swallow during feeding. This can help prevent gas and discomfort. There are several positions you can try for burping. The most common one is over the shoulder. Hold your baby against your chest so their chin is resting on your shoulder. Make sure to support them with one hand and gently pat or rub their back with the other. Another position is sitting on your lap. Sit your baby on your lap facing away from you. Use one hand to support your baby's body, the other to gently pat or rub their back. Lastly, you can lay your baby face down on your lap. Make sure their head is higher than their chest and gently pat or rub their back. Remember to always have a burp cloth ready, as burping can often be accompanied by a little spit up. Feeding and burping your baby can be a beautiful bonding experience. Remember to stay calm and patient. This is all new to your baby too, and with your care and attention, they'll be comfortable and content in no time. Scene script. Next, we're going to talk about diapering your newborn. Changing the diaper might seem like a daunting task, especially for first-time parents, but let's break it down and make it as easy as possible. First, gather all your supplies. This should include a clean diaper, baby wipes, or a cloth with warm water, And a diaper rash cream or ointment, it's also a good idea to have a change of clothes nearby just in case things get a bit messy. To identify when your baby's diaper is full, you'll need to do a little detective work. Newborns typically need changing every 2 to 3 hours. However, every baby is different, so pay attention to cues like fussiness, a heavy diaper, or a noticeable smell. Now let's move on to the actual changing process. Lay your baby on a clean, safe surface and always keep one hand on your baby for safety. Carefully open the dirty diaper, but don't remove it just yet. Use the front part of the diaper to wipe away as much mess as possible. Then use your baby wipes to clean from front to back, especially for girls, to avoid causing any infections. Once your baby is clean, lift their legs and slide out the dirty diaper. Slide a clean diaper under them, ensuring the tabs are on the bottom half. The back of the diaper should be at waist level. If your baby is a boy, point his penis down so he pees into the diaper, not out of it. Before you secure the diaper, apply a thin layer of diaper rash cream or ointment to prevent or treat diaper rash. Secure the diaper, but not too tight. You should be able to fit 2 fingers between the diaper and your baby's stomach. That's it. You've successfully changed a diaper. Remember, it's normal to feel a bit clumsy at first, but don't worry, with time and practice, you'll soon get the hang of it. Remember to wash your hands thoroughly and sanitize the changing area after each use. This will help prevent the spread of germs and keep your baby healthy. With practice, you'll become a diaper changing pro in no time. Finally, let's discuss some techniques to soothe a crying baby. When your little one is upset, it can be a trying time, not just for them, but for you as well. But don't worry, there are several tried and true methods to help calm your baby. One such technique is swaddling. Swaddling is the art of snugly wrapping your baby in a blanket for warmth and security. It can keep your baby from being disturbed by their own startle reflex, and can help them stay warm and toasty for the first few days of life until their internal thermostat kicks in. Next, we have the shushing technique. It might sound counterintuitive to shush a crying baby, but think about it. Your baby has spent 9 months in a relatively noisy womb. The shushing sound can mimic the white noise they're accustomed to and help them settle down. Then there's the rocking technique. Gentle, rhythmic rocking is a soothing and familiar comfort for babies who may have felt a similar sensation when they were in the womb. You can rock your baby in your arms or use a baby swing, but remember, the key to all these techniques is staying calm. Your baby can pick up on your stress and become more agitated. So, take a deep breath and know that it's perfectly normal for babies to cry. It's their way of communicating. It's also important to note sometimes, despite your best efforts, your baby might continue to cry. This doesn't mean you're doing something wrong. Each baby is unique, and what works for one might not work for another. It's a process of trial and error, and that's okay. So remember these soothing techniques: swaddling, shushing, and rocking. Try them out, stay calm, and give yourself grace. Parenting is a journey, and you're doing a great job. Remember, it's okay if your baby cries. It's their way of communicating with you. Stay calm and patient. So, we've covered tips on your newborn sleep schedule, feeding and burping, diapering, and soothing techniques. Let's do a quick recap. We've talked about the importance of having a sleep schedule and how it can help both you and your baby get the rest you need. Remember, consistency is key. Next, we delved into feeding and burping practices. We emphasized the significance of burping your baby after every feeding to prevent discomfort from gas. We also discussed diapering and how crucial it is to change your baby's diaper promptly to avoid rashes. Not to forget, always have spare diapers and wipes at hand. Lastly, we explored various soothing techniques. These could be a lifesaver during those tough times when your little one seems inconsolable. Being a new parent can be both challenging and rewarding. It's a roller coaster ride filled with unexpected twists and turns. But the joy of seeing your newborn grow and develop is unmatched. If you ever feel overwhelmed, remember, it's okay to seek help. Reach out to your support system, be it family, friends, or healthcare professionals. Parenting isn't a solo journey, and you're not alone in this. Take each day as it comes, and remember, it's okay to make mistakes. You're learning, and so is your baby. Remember, you're not alone in this journey. Don't hesitate to ask for help if you need it. You're doing a great job, and you've got this.